So Dr. Warr, I know, we started working together, I guess, maybe a year and a half ago, something like that, where you've been using our Xera cone beam. I know you're based in Ashland, Oregon. I'm curious, any other just comments about your practice, just as a little point of introduction?
It's just a bread and butter general dentistry practice. We do a fair amount of surgery, and that was where my interest in a cone beam came up. I was just referring out all of my volumes to a local orthodontist, and we just kind of do a little bit of everything.
Right. Perfect. And so, and I believe before this, had you had experience with cone beam systems before, or was this your first time with kind of hands-on working with it?
This is the first system that I have had in office.
Got it. Okay. And so I guess maybe any thoughts you have about how has the system helped you and helped your practice?
It has helped. So I sold my office 2 years ago.
Okay, got it.
So I actually bought the cone beam and put it into an office that I don't own.
Got it. Okay. Okay.
Because the plan was going to be for me to just do a lot of surgery here. But the reason I bring that up is because the dentist who bought my office does Invisalign.
Got it.
So he uses the system a lot in conjunction with Invisalign for the scans that they do for orthodontic purposes. We use it a lot for our implant surgeries. We do really everything with a fully guided surgical guide.
Yep.
So he bought an iTero shortly after coming into the office. So we pair the intraoral digital scan with the cone beam volume and send that off and get our surgical guides. But then beyond that, it's just been a really useful diagnostic tool. We can see root fractures with it. I'll show you one later on.
Yeah.
People with sinus problems. I'll show you one of those where, a patient was just complaining about, intermittent sinus stuff. And
yeah,
we took a volume and said, hey, you really ought to go see your ENT. And
yeah, right.
So just being able to see things that we have not been able to see previously,
right,
has been super useful.
Yeah, perfect. And so let me ask, how's your experience been working with ImageWorks?
For me, seamless. I mean, James, who I sold to, he's had a lot more hands-on experience working with Rick.
Yep.
And the other support team at ImageWorks. And based on the number of complaints that he has voiced, it has been very minimal. It's been a really good experience for him.
Yeah. If you have a few cases that you'd be willing to show, that'd be great.
Okay. Okay, so this particular patient, just came in routine periodic exam, and one of his concerns was that he'd just been having, he'd been having some sinus troubles. His sinus hadn't felt quite right, and so we took a volume on him, and as you can see, his sinus is entirely occluded. In a variety of directions, and so that was nice to be able to just take that sinus view and be able to show him, hey, something is going on. You should probably go and visit your ENT. So he actually went and visited his ENT and got worked up, and the ENT took care of him, and he feels a lot better now.
Yeah, so this is a great example, and I'm curious, what were the symptoms of the patient when they first came in?
Just kind of congestion, pressure, in the sinus, where they're
Okay.
just like, yeah, it just doesn't feel right.
Right.
Not necessarily acute enough to move them to action. But if you ask them about it when they're sitting there, they'll be like, oh yeah, something is kind of weird here, but I'm not sure what. Yeah, the right and the left maxillary sinuses are very different in him.
Yes, absolutely. Without the cone beam, this would have been information the patient probably never would have been able to get. And given, especially given the symptoms weren't necessarily that dramatic, and it probably helped the patient address the issue that, they may not have gotten addressed otherwise.
Yeah, exactly. We've actually had this occur with several patients, and we're starting to form a stronger connection with our local ENTs because they're seeing that we're sending them work that should be done.
Because that's a great point and I'm curious to get your take on the connection with the ENT. Is it sort of as you're getting more involved and learning more about the various pathologies involving the sinus, I guess I'm just curious, any sort of advice or perspective on how to make that relationship with the local ENT, how to strengthen that, and how that can be, just a productive relationship?
I think one way to strengthen that is learning medical language, medical terminology, so you can speak to them on their level, rather than speaking to them on a dental level. I had just finished the Misch courses, Carl Misch, maybe a year before I sold to him. And so as soon as he came in, I said, you need to take these courses to get up to speed. And Randy Resnick, who's teaching those, he's been teaching them for the past 30 years alongside Carl Misch.
Yep.
But now that Carl Misch has passed away, Randy Resnick does all the teaching. Anyway, he spends a significant portion of time on sinuses and normal sinus anatomy and abnormal sinus anatomy, pathology. And so you come out of that course understanding the maxillary sinus a lot better than you do going into it. And then most will not take the time to sit down and look at CT volumes with you. But being able to send those volumes to that ENT office, or have, like a referral page that you print that has the volume on, just a slice printed on it, where, they can see what's been identified at a glance and be like, oh yeah, this dentist is onto something. I should probably take a closer look at this and pay attention to it.
Got it. Okay. One feedback we sometimes hear is, well, geez, downloading the entire data set, it's very large. How do I email it? Sometimes that's a little clumsy just because it's a very large data set. And there's that little capability on the output where you can actually create a little video of just a video of walking through the slices. And sometimes for some offices, what they love about that is it's sort of like an in-between, right? It's not such a huge data set as the entire DICOM, but it's more information than just simply taking a screenshot of a single slice. And so that's something that some offices like because it's kind of somewhere in between, gives a lot of information, but it's not as huge as the entire data set. Yeah.
Okay, so this is another sinus. So you can see in this area the grafted sinus. And then the sinus membrane is very thickened up above.
Yep.
This patient had come in, we had done a sinus augmentation, everything had gone smoothly, and then she came back about 2 weeks later with an infection. Which was kind of interesting because we always pre-medicate with antibiotics. Anyway, I won't go into the whole protocol that we use, but it was nice to be able to take the CT scan and kind of see the extent of what was going on in her sinus.
Yes.
So you can kind of compare this sinus to that one that we were just looking at. But I was able to see that it didn't, occlude the entire sinus.
Yeah.
I could get a gauge for where she was at, and then prescribe some different antibiotics and put her on a regimen to help her things settle down. we haven't had her back in yet to see how everything healed up.
Okay.
But it's nice having that capability in office. Before I had a cone beam, if I had a complication like that, I had to send someone out to the office that did all my volumes.
Right.
And, then I would have to pay them for that volume.
Right.
And, hassle for the patient, hassle for me. And it's really nice. I think I bring this particular case up because to illustrate the point that it's nice just being able to do it in your own office.
Yep.
Be able to manage the complication, to look at what's going on, to assess the situation, and feel confident that you're seeing things completely.
Yep. Yeah. And I guess to your point, I guess the alternative is you're basically outsourcing it, and all the, not only the costs, but also the inconvenience for both you and the patient of, it's having them to go visit somebody else, and there's just more steps in the process.
Yeah. Yeah. Well, and the essence of time, when you're dealing with an infection, time is important.
That's a good point. So it's, how much longer it might have been before you could have assessed the situation if, you had to outsource this, and that actually could have had an impact on the infection itself.
Right. Exactly.
Yeah, that's a good point.
So this one, this is a patient of James's, and you'll notice that this scan is significantly different from the others.
Yes.
It's a lot smaller.
Yep.
In its volume.
Yep.
And so that's one of the things that I like about this machine is the ability to take a small volume or a large volume.
Yep.
And so in this case, this patient was complaining of some symptoms on her lower left back molar, and you can kind of see this dark area.
Yeah.
Around that root.
Yep.
And so kind of zooming in on that. And if we kind of, right there, I don't know if you can see that horizontal fracture line.
Oh, yeah. Okay. Yes.
And so the bane of endodontics is the vertical root fracture, or the root fracture that you can't see. So you just keep throwing things at the tooth.
Yeah. Yeah.
Hope that something works. And then when nothing works, you diagnose a root fracture, because what else is there?
You've tried everything else.
Yeah. And so that was nice, being able to see a root fracture on there, and just be able to tell the patient, hey, this is what it is. The tooth is done for, rather than going through the whole root canal process and having them spend money that way.
Yeah, absolutely.
So I like this image because it shows that you can just take a specific volume of a specific area, which is nice.
Yep.
And it shows that this machine has some pretty incredible resolution.
Yep.
It is quite amazing.
Yeah.
And able to see the three-dimensional shape of the defect, because that helps in diagnosis as well.
Yep. You said it exactly right, where had you not had this information, that could have been there's a lot of information. You might have tried other things that may cause more risk and worse outcomes, and it would have possibly taken you longer to get to that conclusion without the information.
Right. Yeah. Really what you're getting at is trust.
Yeah.
The patient thinks, can I trust what this person's telling me? So I find that the best image for that is the three-dimensional rendering.
Yeah.
Because the other ones don't make a lot of sense to patients.
Yes.
But when you show them the three-dimensional rendering, and you can say, hey, this is exactly what you look like without skin, and I can tell you
right.
with certainty that there's a nerve right there. And we're taking this tooth out, and I know exactly where that nerve is in relation to those tooth roots. You can give them that level of detail, and
Right.
they're like, oh yeah,
Yep.
A, you can see what they're talking about. B, they've got these tools that help them see everything.
Yep.
And so, yeah, I should believe what they're saying.
Yeah. Absolutely. And the other thing that we hear a lot is not only increasing the acceptance by the patient, but to a certain extent, sometimes we refer to it as case acceptance efficiency, which is the idea of it's a faster process. So perhaps otherwise they may come to the same conclusion and agree to move forward, but perhaps it's just they have to think about it. Perhaps they want second opinions, whereas obviously having the data and having the cone beam perhaps makes that whole process much faster, just for all the reasons you just mentioned.
Yeah, the cone beam is to radiographs what the intraoral camera is to the patient hand mirror.
Yeah, yes,
that's a good analogy. You can't see a whole lot.
Yep.
But when you take the intraoral photograph and put it on,
a big screen,
27-inch monitor, they can see exactly what you're looking at.
Yep.
And so, yeah, it definitely accelerates that acceptance.
That's a great analogy. I'm going to use that. I'm going to steal that from you. I hope you don't mind.
Go right ahead.
That's a great analogy. I'm just curious, from your perspective, who do you think are the ones that would be a good fit for ImageWorks?
A cone beam would be a good investment for any office.
Yep.
And so then it becomes which cone beam system. And for me, some of the things that Rick shared with me in terms of the compatibility, the future thinking compatibilities that Yoshida is designing into their systems.
Yep.
That was important to me. The resolution was important to me. So one piece of wisdom that you can probably share with your sales team.
Yeah.
Clayton Christensen, does that name sound familiar to you?
Yeah, absolutely. Sure. Yep.
Yeah, the late Clayton Christensen said, the most expensive piece of equipment is the piece that you don't have, but you should. And
Yes.
I read that as I was in the midst of thinking about whether or not to buy a cone beam. And that was really what kind of pushed me to it, because I knew I needed it, but it was just a lot of money to spend. And I should have done it earlier. Clayton Christensen wrote the
Innovator's Dilemma.
Innovator's Dilemma.
Yes.
How will you measure your life? The Capitalist's Dilemma. Harvard Business School professor. Extremely intelligent mind.
It's funny you say that. That's something that we incorporate a little bit into our company. We sort of the challenges of big companies and how big companies sometimes struggle to innovate. And well, that's great. Well, hey, Dr. Warr, again, I appreciate your time and, appreciate all your help.
Thanks. Yeah, you bet. Hope you have a great day.